Hi, I'm Steve Reynolds, a professor in exposure science at Colorado State University. I'm located in the Department of Environmental and Radiological Health Sciences, which is actually part of veterinary college. My current focus and concentration in the MPH program is in occupational and environmental health. I've been involved with that and actually served as the leader for that focus area when we created the Colorado School of Public Health. Courses that I teach related to the graduate program in public health at CSU include an introductory industrial hygiene course, which is a graduate class in our department, a course called Advanced Occupational Health, and I also am involved in teaching a couple of classes that focus primarily on interactions of multidisciplinary teams of students with community partners. For example, current effort right now is working with Rocky Mountain National Park on trying to understand and reduce injuries and fatalities of visitors in the park. The work that I do spans a fairly broad area of environmental and occupational health. In terms of my research, my real specialty is related to exposure assessment for bioaerosols, bacteria, fungi, and other biological agents, developing better methods to really understand exposures both in the workplace and for the general public, and then applying those methodologies to evaluate causes and ways to prevent respiratory disease, especially asthma and asthma-like diseases. More broadly with that work, I head up two centers, larger groups that look at public health from a fairly comprehensive perspective. One of those centers is called the Mountain and Plains Education Research Center. It includes departments, faculty, and students from the University of Colorado at Denver, as well as Colorado State University. And the focus of that group is on training graduate students, medical residents, industrial hygienists, occupational health psychologists, ergonomists, and health physicists in occupational health, and especially providing support for the students, providing training on multidisciplinary approaches, and serving as an avenue to really try to create interaction and communication between those different disciplines. The second center that I head up is located here at CSU, funded by the Centers for Disease Control, and is called the High Plains Intermountain Center for Agricultural Health and Safety. We have 10 of these centers around the country that have regional responsibility for doing research to understand the causes of health problems and fatalities, again, in agriculture, research to develop and test cost-effective interventions, and outreach activities. So we, in our center, cover the states of Montana, Wyoming, North Dakota, South Dakota, Utah, and Colorado. And again, we have a very comprehensive portfolio in terms of addressing, all of the agricultural sectors that are involved. In our region, there is a very heavy emphasis on production of beef cattle. Dairy is growing very, very rapidly in our area, but it's also extremely diverse. A lot of crop production, fruits, cantaloupe, peaches are something that Colorado is known for, wheat, corn. So it's very, very diverse. One of the areas where we've been focusing a lot of our effort recently has been on livestock production, and particularly with the dairy industry. And with that work, we are now involved in leading an international research consortium of 15 countries that is focusing on working with the dairy industry to make sure that they have a healthy, sustainable workforce, and at the same time are sustaining the production side and have healthy and productive cattle. One of the major aspects that we have that's of a lot of interest, I think, is in addition to the focus on the workforce in these environments, there is potentially a lot of impact and concern on public health. Emissions, for example, from livestock facilities may have some impact on air quality of nearby residents, or at least a perception of that. And we do get involved with the public health side of things and looking at potential exposures in communities, trying to work with communities and producers to resolve any issues that they have related to those production areas. So again, very, very wide in terms of our approach. Much of our emphasis is on forming partnerships and working with partners, and that's something that we try to provide as an example for our graduate students and have them very heavily involved in working with our community partners on resolving the problems that they're dealing with. Some of the current issues and trends that we are seeing in public health, and especially related to the occupational health side of things, are really some changes in the way that we as a society are dealing with risk assessment and risk management. Much of the work that I've done over the years has actually been working with former Soviet countries, and I still continue to do a lot of work in scientific societies. ACGIH is one that establishes occupational exposure limits and exposure guidelines that are used around the world. And some of the things that we're seeing are some drastic changes in Europe in particular, but the US and other parts of the globe are approaching these as well. So one of the things we're having to deal with is a shift in kind of a paradigm shift in terms of how we're approaching understanding risk, developing risk estimates, and again on that implementation and application of the risk. A couple of other issues that I think are major trends that we are working on already but are going to continue to be dramatic issues are our aging population. This is having an impact both in the occupational setting and from a broader environmental setting. As that population ages, one of the things that we're seeing as well is that we are finding larger groups of what we might call sensitive individuals or more susceptible individuals. And asthma is an example where there is a continuing rise in the number of people or the proportion of our population that is suffering from a variety of asthma and asthma-like related diseases. As we know more and develop more sensitive tools for things like genetic screening, we're understanding quite a bit more about why certain individuals are at risk with certain types of genetic mutations. And it raises dilemmas in terms of how do you deal with that information from a risk management standpoint in understanding who is at risk. How far do you go in looking at personal information and personal attributes, such as genetics? So there really are a lot of ethical issues that we need to deal with. There are a lot of opportunities we're seeing, though, through that type of approach where we may be able to actually prevent a disease in individuals if we understand some of those factors and then how to develop preventive strategies related to those. Maybe one last area to mention, which in some ways is related to both of those, is that with the changes we are seeing in climate change, we are beginning to see some changes in the patterns of infectious disease, of asthma in different parts of the globe. And that's something that, again, we need to put more of our effort into understanding the impacts of those climate changes and understanding, again, how we can respond or anticipate the effects of some of those changes. Potential career paths for students are something else that I think are also changing a bit from the traditional. One of the things that we're seeing as with the globalization of our economies, and this especially has been brought forth in our work with the dairy industry, is that is really having an impact on how nations are investing in public health, where some of the opportunities might lie. And it certainly looks like private sector is an area that is going to have to step up and is stepping up in terms of providing employment and opportunities for applications in public health. Traditionally, our graduates work in pretty much any sector that you can think of. We have graduates that are working in public health agencies, traditional agencies both on a state level, on a county level, national level, at Centers for Disease Control, National Institutes of Health. We also have quite a number of our graduates that are working in the military in the U.S., particularly in the Air Force and Navy. A number of our graduates have worked for NGOs. Peace Corps is one opportunity. So one of the things that I've seen is that there really tend to be no limits. If you can be very creative, and career opportunities can go down paths that you might not anticipate. In terms of courses that I might recommend in our concentration in environmental and occupational health, there are a couple in particular, including one of our introductory classes in environmental occupational health that Dr. Ramsdale teaches. Two of the courses that I teach that focus heavily on the exposure science side of things are the introductory class in industrial or occupational hygiene, and one that's more broad from a public health standpoint would be our advanced occupational health class, which again does have a focus on occupation, but we don't neglect the environmental side. It's not possible really to separate those two areas.